So a pacemaker is a small medical device that sits under the skin near the shoulder and guarantees the patient a minimum heart rate. So we can use that to prevent very slow heart rates for people who've had problems maybe with dizziness or falling over due to a slow heart rate. We can also use it in combination with other medical procedures such as ablations as a way to regularize their heartbeat for patients who are experiencing irregular beats and symptoms related to that. I place pacemakers in two populations of patients, really. Firstly, people with troublesome slow heartbeats who would benefit from a slightly faster heartbeat. And secondly, patients with troublesome irregular heartbeats who would feel better if they had a regular heart rhythm. So the pacemaker implant procedure is very straightforward. It's performed under local anaesthetic with plenty of sedation, so you don't remember too much about it afterwards. We get access to a small vein near the shoulder, and implant leads down the vein into the heart. Depending on the sophistication of the device, there may be 1, 2, or even 3 leads, depending on whether you have heart failure, depending on whether you have other cardiac conditions. We then connect those leads to a generator, which is essentially a battery with a small onboard computer, and that generator then sits in a small pocket under the skin near the shoulder. The whole implant procedure takes maybe an hour and a half for a more complex device. It does carry some small complication risks, but generally we find these procedures very straightforward. So there are two areas of restriction, really, one temporary and one permanent once you have the pacemaker put in. So the temporary restrictions relate to the risk of dislodging or moving the leads in the heart before they've healed and scarred firmly into place. So for the first couple of weeks after an implant, we ask you not to do star jumps, for example, or lift your left arm above your roughly horizontal, or carry very heavy weights with the left arm. In the longer term, the restrictions really relate to the electronic function of the device. So we'd prefer it if you didn't carry a mobile phone in a breast pocket just over the device. There's a theoretical risk that that can interfere with the electrical circuitry. And also, we don't like you to grab onto and hold onto for prolonged periods pots and pans sitting on an induction hob, because that can also interfere with the function of the device. I have to say that these risks, the long-term risks, are very low and in the main theoretical. I've never once seen a patient with a serious problem related to either a mobile phone or an induction hob. This is a really interesting question, and I think and a whole area that is really quite badly misunderstood by a lot of patients when they have the pacemaker first put in. So we don't tend to touch the leads that go down into the heart after the pacemaker has been implanted unless there's a problem with it. So any subsequent procedures you have to renew the pacemaker or prolong its life would just be dealing with the battery, the part that sits just under the skin near the shoulder. And that will need to be replaced. The frequency with which that's needed depends on how much you use the device and how sophisticated a device you have. So a very straightforward single lead pacemaker that just kicks in once in a while to stop you falling over due to a low heart rate will probably last these days up to about 15 years, maybe even longer. At the other end of the scale, we have sophisticated devices that can shock the heart out of funny fast rhythms, that can help treat heart failure, and they may last closer to 8 to 10 years, depending on the manufacturer, depending on the battery of the precise device.